Good morning, this is Dr. Jones with Inspire Dental, and today we're going to talk about emergency dental services. So what qualifies as a dental emergency is any type of immediate pain, infection that suddenly just causes your face to swell, get a headache, even can cause a fever, difficulty breathing, swallowing, a fractured tooth, a broken restoration. All these things kind of constitute a dental emergency. Even immediate gum issues as well. If suddenly we just have this inflammation in our gums or the sudden pain in our gums, all those would be a dental emergency. So say if your emergency involves you losing a tooth. Your tooth got knocked out, you bit into something and it breaks. What you should do is, if you have the whole tooth, put it in a glass of milk immediately and call the dentist. Whenever a tooth falls out or is knocked out, there's a good possibility that we can reimplant the tooth back in your mouth. But the longer it is exposed to air, then the less likelihood that we could reimplant it. And so that's why getting into something like milk is very important, because when it's in milk, the milk actually is non-acidic, and that actually helps preserve the tooth. You do not want to put it into something like water, because then that actually can kill the tooth, and then we wouldn't be able to reimplant it. So that's what you would do if you have a tooth that suddenly comes out unexpectedly. So a lot of times questions we get asked are like, well, can you treat it, if I break my tooth, can you treat it in one visit? And it really depends on the type of break. If it's a break that doesn't involve the nerve, just maybe part of the tooth broke off, then yes, we can treat it in one visit. What we would do is we would just build the tooth back up, make it whole again, or even possibly prepare the tooth for a crown. Now, if it is involving like a crown or a root canal, well, then it's going to take more than one visit to fix that tooth. And then we would just go through the normal process of fixing it. But a lot of times, at most, we can get down to 2 visits. So say if your dental emergency happens after hours, well, no sweat, call our office. We have an option for you to choose that will connect you to me, Dr. Jones, and I always have my phone on, no matter what time of day. And so even if it's in the middle of the night, I will answer the phone and respond to your dental emergency so I can provide you immediate help. Now, say if you are not in a position to come in right away, but you're having a toothache, there are ways that you can manage it at home. The way that I find to be the most effective is to take some Tylenol and Advil together at the same time. Both of those are kind of mild pain meds, but when you take them together at the same time, it actually gives you a stronger result of pain control, because they chemically react with one another and they actually have really good pain coverage. So you would take 1 Tylenol with 3 Advil, and when you make that combination, that's like the sweet way of taking care of pain. And oftentimes that combination is what I recommend even after like a root canal or surgery or something. And so I would say that's the best, most effective way. There are things like Orajel and that you can buy over the counter to help with tooth pain, but I find that they just they'll numb it a little bit, but they don't really fully get rid of the pain. And so the best way, like I said, is to take that Advil Tylenol combination. So this is just a quick video just covering a little bit information about dental emergencies and what you can do and what to expect and how to manage. I hope it was helpful for you. If you're having a dental emergency or you have more questions, please call our office at 210-734-5092. You can also request an appointment or find information on our website at inspiredentalsa.com. We look forward to caring for you and helping you. Thank you so much.